Welcome, everyone. I'm so glad you could join us today. My name's Aline Sigler. I'm with Provider Outreach and Education at WPS. Also on the line with me today is Karen Curtis. She's acting as my co-host today, supporting me. And so I want to thank her so much for her assistance. The purpose of today's webinar is to talk about direct data entry. It's part of a series that we're doing that's focusing on navigating indirect data entry, or DDE, which you might have heard it called. We have other courses about how to check eligibility, moving around in the system. We have one coming up about correcting claims, and then one that we started out with background information, how to get started with DDE. If you weren't able to join us live, they will all be available as an encore. So if you want to watch, rewatch, or share them, you can do that. Our goal is to learn more about entering claims in DDE. I realize that the majority of you probably transmit your claims to Medicare electronically in batches, but on occasion, you may need to key an individual claim. So it's important to review that function as well. Our time together includes navigating to the claims/attachments menu, and we'll look at that, reviewing the pages of a claim, and determining what information goes on each of those pages. Now, along the way, you'll notice that we're sharing some tips and reminders that will hopefully help you also, whether you're brand new to using DDE or you've been using it for years and you're just looking for a refresher. Hopefully there's something for everyone within this program. Now, depending on your experience with DDE, you might already be very comfortable with this, but others we realize may be starting out. Some of you actually noted on your registration that you're brand new and you're just trying to learn everything you can about DDE. So it is really important to know how to move around in DDE. So we're going to briefly start with some common keyboard commands and their function with respect to navigating in the DDE system. So I have some of the most common keyboard shortcuts here, and we're just going to go down the columns here. The arrow keys allow you to move one character or one space at a time in any direction within a field. So up, down, right, left, all of those. Your tab key is really important. Your tab key is what you're going to use to move forward between fields. And this is the recommended movement to go to the next required field based on the type of bill of the claim that you're entering or correcting. Some keyboards have been equipped with a back tab key. If yours is not, press and hold the Shift key while you press the tab key to move backwards between fields. Now, just to reiterate what I stated a moment ago, and to give you more of the reason behind why we strongly suggest using the tab key to move between fields rather than your space bar, your arrow keys, or manually placing your cursor with your mouse. Because within DDE, the system could see a space as a character. So you could get an error on something you can't even see. So we try to remind everybody to use that tab key rather than those other things. And I realize that we are in the habit of doing things a certain way, and this just makes us pause and reconsider and think about why we do things a certain way and what works best within the DDE system. So for that same reason that the system could see a space as a character, when you're removing or erasing characters, we suggest using the End key rather than your space bar or your backspace key to clear fields. If you attempt to type in an invalid field position, so you try to key something within a field that is, I'm using air quotes, locked, you could get an error and your keyboard could actually lock on you. So if you need to unlock your keyboard and reset your session, press your escape key and then use your tab key to move your cursor to the next valid field position. So it's just going to jump from field to field. And again, that's going to depend on your type of bill as to which fields are open. And finally, you're going to use your home key. That's really useful. Pressing the home key is going to move the cursor to the page number field. And that way you can quickly jump to different pages within a claim by entering the page you want to go to and pressing enter. It does have other uses as well, and we'll talk about those a little later, so be listening for that. Next, we have the program function keys. Now, depending on your particular keyboard setup, you might have F keys, F for function, or PF keys. So if, like in the screenshot, we have F1, F2, etc. Yours may be PF, and that's perfectly okay. They mean the same thing. Now, the use of these function keys or program function keys directs the action to be taken within DDE. So this is for things such as moving within screens, updating a record, and DDE explains what function keys are available for use at the bottom of each screen. So you'll know what your options are, and you'll see examples of that throughout the presentation today. F1 is your help function. So if you're in a claims inquiry or a correction screen, F1 takes you to a description of the reason code or the edit. Press F1 while your cursor's anywhere on a particular screen to receive an explanation of the reason code or the first reason code if your claim has more than one. We refer to F2 as your jump function. So it's for line item detail and other information. F3 is like your back button. So you can exit a screen and be taken back to where you were previously. F4 takes you completely out of DDE and terminates your session. So you only want to do that if you're ready to. We don't want you to lose your work. F5 and F6 are for scrolling within a page. F5 scrolls up or backward, and F6 scrolls down or forward. F7 and F8 are used to move one page within a claim. F7 will take you back a page, and F8 will move you one page forward. F9 is what transmits your data. So you might hear us say, update the claim, save the claim, store the claim. F10 and F11 scroll to the left and the right within a record. And this option is only available from certain pages or screens. And again, you're going to know because it's going to be listed at the bottom of the page that you're on. So we just wanted to do a quick overview of those commands. We did do a separate session on navigating in DDE where we talk a little bit more and give examples of each of these functions. So to get into the place where we can begin to enter a claim in DDE, we're going to start with the DDE main menu. Its purpose is to provide navigation in the DDE system, so it all starts here. One thing I want to point out, if you're not familiar, is that every screen in DDE is referred to or named by a map number in the top left field. The main menu is MAP or map 1701. So just as an example here, and when you look at the DDE manual, if you haven't already, you're going to see these page numbers named and referred to. And so I wanted to make sure that you knew where you could find that and see that. So you see here that there's different menu selections. To select the claims/attachments menu, enter a 2 at the bottom of the page. So again, you're going to use your tab key to go to that enter menu selection field down here. And then you can enter 2 or 02 and press enter. The 0 is actually not required. I just typed it as it's shown as an example. So once you do that and press enter, then you're going to see the claim/attachments submenu. Each of these submenus also have a 2-digit code associated with them off to the right. So these are the selections for that. And it's going to be based on your facility type and type of claim. So 20 for inpatient, 22 for outpatient, 24 for skilled nursing facility, and 87 for roster bills. Now, WPS doesn't currently process claims for home health or hospice. So you'll notice that those options are there, but that's why we didn't mention them, because you won't be billing those to us. So you're going to choose the one that you need based on your facility type or what you're billing for. Enter the code at the bottom. Again, you're going to use your tab key to go to this menu selection, enter your 2-digit code, and press your enter key. So then you're going to be on page 1 of a DDE claim form, and it includes general patient and provider information. It also has information about the claim's admission date, type, and source, condition codes, occurrence codes, and value codes. So you're going to begin entering claim data and continue until the appropriate fields are completed. Remember, the easiest way to move from field to field is to use your tab key. Most fields are self-explanatory. A couple items to make note of: the patient's name. You should enter it exactly as it's shown on their Medicare card and in the common working file, which is the patient's master record with Social Security. People go by nicknames all of the time, but use what the Medicare card and Social Security records show. If you do otherwise, it's probably going to cause errors and hold your claim up. The discharge status code indicates the status of the patient as of the through date on the claim. So this is either the end of the billing cycle or discharge from the facility. This tells the system where the patient went and helps to properly track the patient's benefit period. Not using the correct discharge status can cause issues for you. It can cause issues for the patient. It can even cause issues for other providers down the road. Condition codes. They identify events related to the bill. They give the system and essentially CMS more information about the patient's stay. A couple examples are a 04. A 04 condition code acknowledges that the patient is enrolled in a Medicare Advantage plan, but you might need to bill what we call a encounter claim to Medicare to track days if it's an inpatient stay, things like that. Another example is a 07. That tells the system that the patient has elected their hospice benefit, but your claim or your services are not related to the patient's terminal diagnosis. So by doing that, it's going to bypass those hospice edits. A 21 condition code, again, just giving you a couple examples, is used when billing for a denial notice, either when the patient's at a non-covered level of care, or when you're billing for excluded services the Medicare doesn't pay for, and you just need a denial for another insurance perhaps. So I just wanted to give you a couple examples of things you may encounter, some that are pretty common. Now, occurrence codes indicate when a specific action happened. So an occurrence code is a 2-digit code that identifies an event or an action, but it also includes the date of that event or action. Some examples of this might be a 24. A 24 occurrence code is the date the primary insurance denied the services. A 32 is the date the advanced beneficiary notice of non-coverage, or ABN, was given. Similarly are the occurrence span codes. They identify a specific action or event, but a beginning and ending date associated with it. Examples include the qualifying hospital stay dates for skilled nursing facilities. They're indicated with a 70 occurrence span. A 74 occurrence span tells us that a non-covered level of care or dates when a patient was on a leave of absence. Now let's talk about value codes. Value codes indicate a specific action, and then there's an amount associated with it. It's a 2-digit code identifying the action and a quantity of an amount, or dollars and cents. Some examples of value codes are a 09 for the coinsurance amount applied to the claim. Another example is an A0, which is used by ambulances for the zip code of the point of pickup. Or another one that you may see often is when Medicare is the secondary payer. There's a value code indicating the type of insurance. So like a 12 for working aged, 43 for disability, or 15 for workers' compensation. And then there's a dollar amount, the amount paid by the primary insurance, so that Medicare can calculate a possible secondary payment. Now, once you've finished entering everything on page 1 here, you'll press F8 to go to page 2. But before we look at page 2, I want to share some additional information about page 1 of the claim. It allows space for 10 condition codes, 10 occurrence codes and dates, and 9 value codes and amounts. However, you can enter up to 30 condition codes, 30 occurrence codes and dates, and up to 36 value codes and amounts. So to get to these additional fields, you're going to use your F6 key to access those additional spaces for those fields. Remember, F6 scrolls forward within a page. When keying amounts in the value codes field, the system automatically adds the decimal 2 spaces to the left. So you don't have to type it, but it is important to ensure that the appropriate cents value is entered, regardless of whether the decimal point is used when you're keying it. Couple more tips here. When page 1 of the claim appears, FIS, which is the Fiscal Intermediary Standard System, this automatically inserts default information into the type of bill field and the status location field. DDE defaults to bill type 111 for inpatient, 131 for outpatient, and 211 for skilled nursing facilities. So when you first choose that submenu selection for inpatient, outpatient, or SNF, if you're going to be entering a different bill type, then you have to type over the default with the correct type of bill. Now, your vendor may personalize your system for you. So if you're a critical access hospital and you choose outpatient, it may automatically default to an 851, and that's been customized by your vendor. So keep that in mind. Depending on the type of bill, your cursor is going to skip fields that are not required when you use the tab key. So that type of bill is important to open or not open those corresponding fields. Now, page 2 is important when you're keying claims, because this is where you're going to list all the items and services that you're billing for. It contains revenue code information, HCPCS codes, charges, and service dates. In the top portion, some of the items from page 1 will automatically be populated, such as the patient's Medicare number, your provider number, the status location, and the type of bill. As we go across the page, the other fields are the claim line number, just highlighting it here for you. This is the number of the line item. It identifies the line number of the revenue code. In entry mode, this field is filled by the system when the claim's processed, so it's going to be visible for update inquiry. Next is the specific revenue code for the service. This is a 4-position field with a leading 0, but you don't have to key that leading 0. If we continue to tab across, we see that next is HCPCS. So this is the code for the service provided and any relevant modifiers for that HCPCS code. The rate is the unit cost for the service. Total units is the number of the units for that specific line item. Covered units, the number of covered units for that line item. Usually that's the total of the units, but not always. Total charges is the total amount you're charging for that service. Non-covered charges is the portion of the charges not covered by Medicare. Service date is the date the service was provided. And then you'll keep adding charges. And when you're finished, your last line will be revenue code 0001 for the total. Once you have that all added, you're going to use your F8 key to go to page 3. Like with page 1, I do have some tips for you regarding page 2. So I'd like to outline the process here for adding or removing a line of revenue. We've actually gotten this question a lot. It is outlined in the DDE manual. If you want to or need to delete a revenue code line, type 4 zeros over the revenue code to be deleted, or type D as in dog in the first position of the revenue code, press your home key and then enter. The home key is going to position the cursor in the page number field. Then you're going to make sure that you adjust your total charges to reflect any deletions. The system isn't automatically going to recalculate it for you. You have to do that. If you need to insert a revenue code line, so you've got all your lines typed and you have your total line, but then you realize you skipped a line, so you need to add one. To insert it, this is important, type the appropriate information after the 000 line, so below that. And then once you've typed all the information on that line, you're inserting, again, press your home key and press enter. DDE then is going to resort the revenue code lines, and then you'll need to make sure you adjust your total charges on that 0001 line. Couple more things. Each page holds up to 14 revenue code lines. So if you need additional revenue code lines, you're going to use your F6 key to scroll down. There are 450 total line codes that are allowed per claim. Depending on what you're for, it may be one line for a rural health clinic, let's say, or it could be multiple pages up to 450 lines for, let's say, a long inpatient claim. Each line of revenue on page 2 has room for 2 modifiers. Pressing F11 twice while on claim page 2 will take you to map 171A which we'll actually look at in just a minute here, and that will allow entry of 3 more modifiers. You can place your cursor on the claim line number above the revenue code field to allow immediate movement to that desired revenue code line. So that CL field that we looked at a couple slides back, that's going to allow you to jump to that line. Again, that's going to be really helpful and save you a lot of time, especially if you have lots and lots of lines of revenue. Some pages in DDE, like page 2, have 1 or more additional pages for detailed information. So we're going to look at a couple of those next. 171E is used to enter line level referring and ordering National Provider Identifier, NPI, information. Some hospitals have to include National Drug Code, NDC, information for unclassified drugs and biologicals. And this information is also added on this screen in the corresponding line item of the drug code. We had a question that was submitted about Z code entry, and the registrant didn't state if it was ICD-10 or molecular diagnostic services that they were referring to. But if it is MolDX, you can see that the field here on the right, and I've highlighted it here, is where you're going to enter that 5-character alphanumeric Z code for MolDX next to the corresponding line item for the molecular pathology service. You're only going to enter the Z code itself without adding extra characters, spaces, or descriptive test names, because that could cause the claim to be errored out or returned to provider. So I just wanted to point that out. That was a question that was submitted during registration. Here is 171A. Now, most of the fields on this screen are systematically filled, but like I mentioned, pressing F11 twice while on claim page 2 will take you to this screen to allow entry of more than 2 modifiers. (171D). You're going to press F2, your jump key, while you're on claim page 2 to go to this screen. If when you're checking your claims later, if you receive any initial line reason codes, you can view them here. Down here towards the bottom, I should have highlighted it for you. You would see line item reason codes. Can press F6 to scroll through the lines until you get to the one you need. Or while you're on page 2 of the claim, you can place your cursor on the claim line number above the revenue code field and then press F2 to immediately go to that specific revenue code line. Page 3 of the claim is used to add information like diagnosis codes, procedure codes, physician details, payer information, and estimated amounts due from the patient. Specific fields include diagnosis codes for principal and other conditions coexisting at the time of admission or which developed subsequently, and which had an effect on the treatment given or the length of stay. Attending and referring physician information, which would be the NPI and the name, and then monetary details such as the estimated amount due and the amount due from the patient. Then again, we're going to F8 to go to page 4. And I failed to point this out, but here's what I was talking about in the beginning, where each page gives you what your options are for your PF or F function keys down here. Couple tips and reminders for page 3 to share with you. Decimal points are not required and should not be entered for diagnosis and procedure codes. If you need more space for additional codes, you can F6 to scroll forward, and then up to 24 of each are accepted. Claim page 3, 1719, which is a subsequent page. You can press F11 one time from page 3 to access this page. It's been created to house payment information for up to 2 payers primary to Medicare. So if Medicare is the secondary or tertiary payer. It also contains claim adjustment segment or CAS information, which is required for Medicare secondary payer claims. Page 4 is where you're going to place any remarks, depending on the situation. Sometimes remarks are required, and sometimes they must be formatted in a specific way because the system is programmed to read them. And we call those verbatim remarks. It's important to follow instructions because if you don't, it could hold up your claim. There are up to 3 additional remarks screens, and you'll use F6 to see additional pages. When you're done with page 4, you F8 to the next page, and then you're on claim page 5. And this contains additional payer information and treatment authorization codes. F8 to page 6. Page 6 was designed to show additional insurance information and payment and pricer information. I know we're talking about claim entry, but if you were in here and looking at a claim that's finalized, you could view details about the deductible if it was applied. You could see the paid date, the payment amount, and then the check or the electronic funds transfer number. If it's an inpatient prospective payment system claim, the DRG, diagnosis related group information, may also be visible on this page. Remember that depending on the bill type that you're keying and the situation, not every field on every page will have something to be entered. Once you're done entering all the information for the claim, you'll press F9, and that's going to save, store, transmit that claim. Now, before we go, I also want to talk about a special type of bill that some of you may use, and that's roster bills. A roster bill is a simplified billing method for institutional providers to submit multiple claims for the same type of vaccine on a single roster bill rather than keying individual claims. This process is used for certain immunizations like COVID-19, influenza, and pneumococcal shots to allow for mass billing. It's designed to be quick and easy for providers who can submit a separate roster bill for each type of vaccine administered on the same date of service. And this is done by completing what we call header information that's common to all patients. The type of bill, the provider information, the vaccine coding, the charges are all going to be the same for every person on that day. Then you'll enter the list or the roster of patients who got that vaccine on that date. You'll enter their Medicare beneficiary identifier, their MBI, Medicare ID. For those of you that have been around a while, formerly known as the HIC number, health insurance claim number. You'll also give us the name, the date of birth, the sex, and the admission type for up to 10 patients. So here I have a screenshot of what that form looks like. The type of bill is only a 2-digit field, so you'll disregard the leading 0 and key the first 2 digits, 13, 12, 23, etc. The only revenue codes allowed are 636 for the vaccine and 771 for the administration. If you need details on the valid values for the admit type and source, look at our website or the DDE manual for more information. A couple tips and reminders for raw bills. Number one, check that bill type. Certain fields are required based on the type of bill. If you try to enter a patient, but the fields are locked or inaccessible, check your header elements. Once you complete the header, press enter. That should then open the beneficiary fields. If the admit type field is not accessible, press enter after adding the information for your first patient. When you begin entering patients, the initial screen has space for 4 names. Press F6 for additional spaces. Up to 10 names are accepted per roster bill. Then you'll F9 to submit, and the system will create an individual claim for each beneficiary. I always like to share with you where you go to get more information. So I mentioned the DDE manual, and when you get the slide deck, remember I'm going to send that out to all the attendees of the live session following the webinar. So you'll have that. So if you download the PowerPoint, you'll have these links here. This first link is to the DDE manual. And then the second resource is an article on our website that's titled Direct Data Entry Overview. And this is where you can learn about how to access DDE. Maybe you don't have it yet, you're just trying to learn more about it, because it is a business decision as to whether or not you get yourself or your employees access to it. So I realize some of you are just kind of feeling it out now. That article will tell you about the forms that are required, how to connect to DDE, how to get help with passwords, logins, navigation, that sort of thing. So now what I'd like to do is go over the questions. I specifically shared what I wanted to share with you, and so I realize some of you may have questions. During registration, I asked, what one question are you hoping to have answered during this webinar? And I got a few responses, and I'd like to go over those now. Heather replied with, just to learn how to enter them on the website. So I want to clarify that direct data entry is an application, not a website. So you may be talking about our SecureNet Access portal, which is the secure site of our website. Part A claims, which is what DDE is for. Part A claims cannot be entered in SNAP. Only Part B professional or 1500 claims. So I think there's some confusion there, or maybe misunderstanding on my part. Our next question comes from Dina, and she says, how to submit direct data entry claims and have the processed claim electronically sent to the supplement plan as it does when claims are submitted by mail. And the answer to this is, if the claim is completed properly with the information that matches the crossover file, it should automatically go to the secondary or supplemental insurance. The insurance itself, that supplement or that secondary insurance, is responsible for initiating what we call the transfer agreement and keeping the records up to date. So it's kind of out of WPS's control. So the file is sent to Medicare with the subscribers or the clients and their ID. So if everything matches the claim that comes into WPS, once we've processed it, it should go automatically. The next question we have came from Matthew, and he asks, how to increase time before system signs you out? Idle sessions will inevitably time out after periods of inactivity. If you're talking about direct data entry, though, WPS has no control of that because we don't own or maintain the system. That's done by separate contractors. You might want to contact your vendor for more information. I am not sure if that is something they control or if it's done higher up than that. If you're referring to our portal, if you're referring to Snap, however, that is a 30-minute session lock, and that's set by CMS for security reasons. And again, we don't have any control over that, but thank you for that question. Let's see, next came from Kathy. Kathy came in with, will Part A accept a claim for processing when there's an unlisted code build, such as 64999, if documentation is attached? Where should that documentation be attached? And the answer is yes, the system will accept a claim with an unlisted code, but there's nowhere to attach documentation for that in direct data entry. We ask that you place a description of the service performed in the remarks field, and that should include how the procedure or service was performed, like if it was done laparoscopically, if it was an infusion or whatever, the specific body area that was treated, and why the procedure or service was performed. So explain to us why it was medically necessary. If you're billing electronically, you might consider using what we call the PWK or paperwork segment. This is a segment within the 837 professional and institutional electronic transactions, and it provides a link between the electronic claims and additional documentation that's needed for claim adjudication. And you can find information about it on our website. I've also asked Karen to place a link in the chat. If you're listening to the encore of this webinar, scroll down in the description of the video to find the links. Next came from Chelsea. Chelsea asked, how do I bill for a patient who is inpatient, gets transferred to another facility for a procedure and gets transferred back to our facility on the same day without being discharged from our critical access hospital? We own the ambulance and the staff is employed by our hospital. And I know that was a long question, and this is kind of outside of our topic today. But basically, that's all going to be part of the inpatient stay due to hospital bundling. The second hospital is going to bill you for the services they provided under arrangement, and then you'll include the service on your inpatient bill. Chapter 3 of the Claims Processing Manual, which is 100-4, if you're not familiar, states that certain medical items, supplies, and services furnished to inpatients can only be covered under Part A. Consequently, they're covered by the prospective payment system or reimbursed as reasonable cost under Part A to hospitals excluded from PPS. And she did state that she was a critical access hospital. And it goes on to state that one such service is transportation, including transportation by ambulance to and from another hospital or freestanding facility to receive specialized diagnostic or therapeutic services not available at the facility where the patient is an inpatient. The hospital must include the cost of these services in the appropriate ancillary service cost center, so that means your revenue codes, in the cost of the diagnostic or therapeutic service. So you're not going to put the ambulance under revenue code 540, which is what we're used to doing on our Part B ambulance claims, but rather you're going to include the cost of the transfer into the revenue code center for that service that the patient went to receive. We have just a couple more things that were submitted with registration. Darlene states, correcting claims without duplicates. Correcting claims is done in a separate area in DDE accessed through a different menu from claims entry. If you're listening live today, that webinar is coming up next week. Or if you're listening to the encore, look for the recording in the direct data entry playlist on our YouTube channel. If you're experiencing duplicate rejections when attempting corrections, I suggest you call customer service so that they can look at the example with you and give you pointers on what's happening or what you could do differently to prevent that. And our last pre-submitted question comes from Peyton, who says, which remarks are helpful for reopening claims? And I'm not exactly sure what's meant by this. Most Part A claims can be adjusted to make corrections. So it wouldn't be often that a reopening would be submitted. Now, maybe you're talking about appeals and we're just using different words for the same thing. Or maybe you're referring to a clerical error reopening on a Part B professional claim. Since we're talking about DDE and Part A claims today, I'm not really sure about this one. So Peyton, I would suggest contacting customer service so that they can help understand your situation and give you advice. So now I want to check in with Karen. I want to see if any questions have been placed in the chat today. Karen, do we have any questions?
Thank you so much for all that great information, Aline. Right now, we do not have any questions that have come through in the chat.
All right. Thank you so much for checking on things and watching things. I can't see the chat when I'm sharing my screen, so I really appreciate you. So we're going to move on here. A couple more things for you. First one is overpayments. WPS receives a lot of overpayment notifications and refund requests from providers. And we know that you want to repay Medicare in a timely manner, but there can be delays if you use an incorrect or outdated form. Missing information or sending checks without explanations are also reasons that can cause a delay. To avoid unnecessary holdups, consider using the refunds or overpayment claim adjustment features of SNAP. And again, SNAP is the Secure Net Access Portal. Using SNAP allows fast and efficient processing of your overpayment and refunds to Medicare. Now, we realize there are times when you aren't able to use the online portal features. Instead, you may choose to, or we tell you to send paper requests and checks. If so, we do recommend including the correct form available on our website. At a bare minimum, send documentation as to what that check is for so that it can be applied more quickly and appropriately to the right claim or the right department, whatever the case may be. Karen's placed a link to an article on our website that'll help you determine which action or form to use. This slide here is a provider alert announcing a change to mail delivery for Part A appeals submitted in SNAP. Starting June 1st, all providers with an active SNAP account who submit their appeal requests through the portal will no longer receive decision letters through the U.S. mail. All appeal letters can now be viewed and downloaded directly in SNAP. You're going to get an email notification regarding a decision on your appeal, and then you'll be able to access that immediately, access that appeal correspondence. We have the next National AB MAC Ambulance Supplier and Provider Coalition webinar coming up. That's a mouthful. Coming up next month. It's open for registration, and we're including this slide as advertisement of it. It's going to be held virtually on Wednesday, September 16th from noon to 2 Central Time, which is 1 to 3 Eastern Time. All MACs are going to present information on current active medical review that they're doing. Additional documentation requests, we'll be talking about that. and the Comprehensive Error Rate CERT program, Comprehensive Error Rate Testing program. There's also going to be a live Q&A session. To learn more about the Ambulance Coalition, visit our National ABMAC Ambulance Provider and Supplier Coalition webpage. And even if this event doesn't pertain to you or your job, if you would help us share this so that we can get the most providers on the line possible for this event, it would be appreciated. I mentioned this earlier, but please take a few minutes to complete a survey about this course. Let me know what you liked, what we could do better, and give us suggestions for future education. Depending on how you wish to do this, you have a few options. You can use the link in the chat, or when you exit the webinar, you're going to be asked to go to an external site. And that external site is the CMS Qualtrics page for the survey. And the message is going to look similar to this top box here. It's going to say external site. It's going to have a continue button, but it doesn't really explain what it's for. And so we try to let you know that that's what it's for. And if you click continue, it'll just launch that survey for you. If you're listening to this course as an encore, you're going to get a different box at the end of the survey that links you. And it's going to look like this other box with the finger and the stars. That will be a link. There'll also be a link in the description of the video. So no matter how you do that, you only have to do it once, but please do that. Let us know how we can be better. This education is for you. So if I think it's wonderful, but you don't think it's wonderful, what can I do to make it better? That's the only way that we get the insight into how we're doing and the types of education that you're interested in. Later today, you're going to receive an email to thank you for attending the live event. This email is going to contain a copy of the slide deck and your certificate of achievement. So it's going to have your name and the contact hours. So if you need to turn that in for credit towards continuing education units, you'll have that. You'll be watching for it. If you think of a question later, you do have 1 week from today to submit a follow-up question. Send them to our education mailbox, put today's date and something about direct data entry or even just DDE in your subject line. That way they will come directly to me. I'll put the answers together and send them out. On behalf of myself, Karen, and everyone in Provider Outreach and Education, I want to thank you for your participation and attention today. Hope to have you join us for future education. We look forward to your survey feedback, and you may now disconnect. Have a great day, everybody.